So there's been a lot of research on migrant laborers. You might recognize the first one. I saw that Seth was coming to talk here as well. And there's also this other really popular book, They Leave Their Kidneys in the Fields. And they show major forms of labor and health inequalities faced by immigrants. Because this is a huge issue. It's happening everywhere. It's happening right here in our backyard. And a lot of this research really touches on that. And the idea here then is structural violence. So what this means is how social structures harm people by preventing them from meeting their basic needs. There's health issues that range from heat exposure, pesticide use, chronic disease, kidney disease, and that's where this one really comes in, because just a little glimpse of what they find in these types of studies is people, especially agriculture workers, stay out in the fields for so long that even during just one shift of being out there, they start getting, their kidneys start degenerating. There's a lot of pesticides, a lot of exposures that happen there. And so basically their kidneys are just left in the fields. That's how they see it. And so, so it's a form of violence, and it's not direct violence. They're not going and, knocking them on the head with stuff. But the structure is set up in a way where they are caused harm, whether it's physiological, mental, emotional. There's a lot of harm that goes into this. So just an example, the rate of heat stress fatality for agriculture workers was 20 times higher than the average rate of all other civilian occupations. And that's huge, right? 20 times higher, it makes such a big difference. And that's just being out in the heat for an extended period of time. And it's fatal. So then the question, we're going to kind of move over towards undocumented immigrants. Do undocumented immigrant workers have labor rights in this country? So what do you think? No? A lot of no's. So they do, actually. All laborers, documented or undocumented, have labor rights. So woohoo for that. But we just don't really know about it, right? There's a lot of misconception that they don't because they are undocumented. But OSHA, Occupational Safety Health Association, you guys know the acronym, they have specific regulations for all laborers in this country. They have a right to a healthy and safe workplace, right to information about the workplace. They have a right to training by the employer about how to safely perform the work, which is pretty huge. A right to report unsafe work conditions, so they're allowed to do that. And protection against retaliation for asserting these rights. So you stand up for yourself, you're supposed to be protected. Also, the current law here, though, so if you think about all that, there's also a law that says agriculture workers have to work over 60 hours a week to get overtime. So, what's a regular work week? 40 hours, right? After you do 40 hours, then you are supposed to get overtime. So if you're an agriculture worker, though, you got to do 60. And then you're considered full-time, and then you get overtime. And, that's a little shady, right? Because now it's a new, they're not getting the pay they're supposed to. But there's a new California law that's going to allow overtime for agricultural labor starting in 2019. So it took a really long time. It hasn't even been implemented yet, but, we're kind of on the path. And that law is great. So now it's 55 hours instead of 60. Starting 2019. So you see a marginal improvement. It's going to take until 2022 to actually get a normal 40-hour work week before they start getting overtime. And, keeping our fingers crossed about that, but you never know how things are going to go. So, yeah, they have rights. But, if I want you to take away one thing from our time here today, it's this. It's that they have all of these rights that are, kind of written into our organizations, but they also, have this discrepancy in how long they're working and how they assert their rights and the protections that they have that they may not know about. And so, what do you guys see here? I'm just making sure the picture came out okay.
Working by all of the smoke that's out there. That's like forms of Have you ever seen?
Yeah, yeah, and this is, I think it was the Southern California fires. Yeah. Yeah, we're burning on all sides here. And I mean, if you can kind of see it here, but there's like a glow, that's the fiery glow in the distance, the black smoke, kind of the covered sun. And then, here's migrant workers right here that are working despite these conditions. So why do migrant laborers continue to work under these conditions? What do you think? Why would you be out there in the field with this kind of haze behind you?
Probably wouldn't get paid.
Yeah, they wouldn't get paid. Yeah. Anyone else? Yeah, survival. And that goes right along with getting paid too, because if you're going to have to work and think about from, well, okay, that came out next. But think about the potential hazards, right? So, what kind of hazards are they facing? Just from this picture alone, it's not a trick question. So, there's a lot of smoke, right? Yeah, all the stuff you're inhaling, everything that's going in your lungs. I mean, they're kind of covered, like, I think there's a cloth or something, but we've been hearing from the CDC that's not really enough to stop kind of the long-term damage. And then what about the employer? Like, where's the employer in all this? What are they thinking, do you think?
Well, that bad, they should,
Yeah, they shouldn't have been working, and the employers are allowing that. And yeah, like you said, the crop needs to be harvested, the work needs to be done, business has to be made, we have to keep generating that income. And so if anything, my guess would be that they're probably working them a little extra hard, because if the fire and smoke starts coming over this way, those crops are ruined. So let's gather what we can while we can, but at the same time, you see just the kind of injustice of the situation that's happening. And so, we can just see this in our everyday lives, that we have this labor happening in unsafe conditions at the same time. And so there's a demand for migrant labor while living under the threat of deportation. And so there's this theory of deportation threat dynamic. This is where there's the vulnerability of undocumented migrant laborers that leaves them exposed to exploitation, wage theft, not paying them, or underreporting of injuries. And so we're also living in this era of mass deportation. We're creating conditions where migrants are living in fear. It impacts labor relations and contributes to health conditions. So the comic here is, on one side we have big biz, the big businesses, and then we have ICE on the other side. And they're kind of putting up a similar poster where they want the immigrant laborers, but for totally different reasons, right? The big businesses want them for their cheap exploitable labor. The ICE obviously wants them to get them out of the country, but they're kind of stuck in this like rock and a hard place, because either way they're exposed and vulnerable, and that's why those are the conditions that we're creating, where they're constantly living in fear from one side or the other. Everybody wants them, but it still is just this threat dynamic that they're facing. And so, the biggest industries that are relied upon for immigrant workers, agriculture, as we talked about, construction's a huge one. And there's 17% of agriculture, 13% of construction workers are undocumented. And then this is just another way to look at it. I'm not sure if you can see kind of the difference in color, but kind of up to about there is unauthorized immigrant farm workers. And then there is authorized immigrant farm workers, the kind of red in the middle, and then blue is non-immigrant farm workers. So if you see a lot of the immigrant workers, whether or not they're documented work, they're farm workers. And that's just another way to look at it. And the little person represents 10,000 people. And then Latino workers, then they're at much greater risk. Their job fatality rate is 18% higher than the overall job fatality rate. So if we funnel down, we have our immigrant workers, undocumented workers, and a lot of these are Latino, and they're the ones who are kind of getting hit the hardest. So, the most dangerous jobs in the US with a lot of fatal work injuries: construction, transportation, warehousing, agriculture, forestry. These are where you're seeing just a lot, not just injuries on the job, right? These are fatal injuries. So they're working these very dangerous, hazardous conditions. And so research on day laborers is just, the conditions are actually seen as worsening. So it's weird, right? Because we have all of this information, we know all of these things are happening, and it's actually kind of not improving as much as we'd like for it to be. A lot of their work is considered dirty, dangerous, and demanding. And so if you think of jobs where that is an issue, then that's where the hazards are going to be. There's the proportion of fatal and non-fatal workplace injuries among immigrants. It's actually been increasing. It's on the rise because they work for less pay, longer hours, and in worse conditions than non-migrants. And so overall, as you've been probably learning, there's a lot of immigration happening into this country. And so when you have that, then there's just a lot more jobs, and then there's a lot more injuries on the job. There's a lot more workplace fatalities. They're 2 times more likely to experience wage violations compared to documented workers, and high rates of wage theft, like I said, harassment, exploitation, and they're reluctant to leave because, despite the harsh working conditions, because exactly from what we talked about earlier, they need a job, they need to live, they have bills to pay, and so it's hard to just up and leave a job, especially when you're in that constant threat of deportation, that, what's going to happen to me if I leave? Where am I going to get another job? It's a really difficult position to be in. And so what we are looking at is the perspective of workers first, the laborers. So they're involved in dangerous work, work-related injuries, and unsteady employment. So this is from the article, right? So unsteady employment causes stress because you're not quite sure what's going to happen to you, and you can kind of be fired at a moment's notice, even though you have those rights that we talked about. There's a lot of loopholes in basically every contract. And so that constant anxiety and am I going to have my job tomorrow? You have to work extra hard to make sure that you have it. It causes stress. It causes a lot of mental health issues on top of the work-related injuries. And then there's also insufficient funds for healthcare. So we're all in health. We know that healthcare is not the most affordable thing around. And you can change the premiums, you can change different types of insurance options depending on the type of worker that you have. And so if you don't have enough funding for healthcare, regardless of if you get injured on the job or not, you can't afford to get treated, or much less prevented from experiencing adverse health outcomes. And then they feel more discrimination. So there's a lot of discrimination can be in the form of harassment, in lower pay, then even after years of building community. So I think in one of the articles that was assigned, then one of the quotes that the workers had said was that they're in construction, right? And they're literally building the buildings that the community is using. They were there, for the first brick, and they completed it, the structures. And even then, they formed social ties in the community, but they weren't really part of the community. They were just the workers that, kind of put it together. And so that's a form of discrimination right there, because you sat there and, literally with your bare hands, and you built this community, and then they don't accept you as one of them there, and you're not really a part of it. And so, obviously you're going to feel ostracized and neglected, and from their perspective, it's not fair treatment. And so, prevention in any form is absent. So if you're working at a job where you're exposed to, like we saw the farm workers, those agriculture workers, they're not going to get a lot of prevention treatment. Like, I don't think that they're going to be screened for asthma, or, going to take into clinics or facilities to make sure that their respiratory system is okay. It's just not kind of written in the protocol of things. Work-related illnesses can go undiagnosed despite the risks of the job. And, if something's undiagnosed and not treated, it can affect your longevity and decrease your lifespan, all of that. So the view of day laborers on employers, So this is, employers will not, or they have a limited amount of resources to compensate for work-related injuries or illness. So they could argue that it's just not there. Employers, they won't invest in safety equipment and threaten those who complain, making day laborers feel undervalued and easily replaceable. And so I think one of the quotes and other ones that I've read talk about how they, if you're on the job and you need certain type of protective equipment, you're supposed to be able to ask for it, right? That's your right. But they do ask for it, and then they don't get it, or the employer will say, oh, they're complaining too much and you might get fired for that. So, even the basic rights that you should have, they kind of find ways to get around it, or they just don't want to hire people who complain. And then there's different attitudes on who should be held responsible. So some people think maybe it's the part of the worker. They need to stand up and just, say something, whether or not you lose your job, just go for it. That's your right. And others feel that, well, I don't want to risk losing this job because this is all I have. So I'll just, deal without the hard hat, whatever, and hope that things are okay. So I don't know. It just depends on, the situation, but that was kind of one of the points in the article too. And so structural violence, like we talked about before, the structures that are kind of in place that end up harming the workers. One example is a Florida law that punishes immigrants who are legitimately injured if they had used false social security numbers. So this means there's a law in Florida that says that if you are, let's say you're on the job, something falls on you, breaks your leg. And so, you want to file for workers' comp, you want something to sort of help you through that, right? And then you go to your employer and they find out that you have a false social security number. You just happen to be undocumented, but you got injured and your leg is just, broken. And so what they can do now is since 2006, they can charge you with a felony because they will look through your file and say, okay, your social security number is not valid. Whether or not your leg is broken, you shouldn't be working here, and you can definitely not get help with that, dangling leg. So they're going to be not paying for healthcare, and even more so, they're going to be charging you with a felony, and that's going to be on your record. And so they're not required to pay for your healthcare in that case. And so regardless of what happened, that is a form of structural violence because the social structure is in place. And, it wasn't a violent act that was committed, but it definitely had harmful results. And so that's just kind of how it ties in there. So from the perspective of employers now, and this is a lot of where the research touches in on from the other article you wrote, why study employers of undocumented immigrants. And so this is actually a big area for Juan as well, but basically the story is that, so he was in graduate school at Texas A&M and was kind of doing his own study with his professor on day laborers, and him and another graduate student, they were both Latino, were kind of on the side of the street talking to the day laborers, trying to get survey information from them. And a man pulls up in a truck and asks them, hey, are y'all looking for work? Because this is Texas, that's how we talk there. And, they were kind of surprised because these are two students 1 year away from getting their PhD. And they were, kind of in shock, like, oh, well, no, we're not looking for work. But it kind of got the wheels turning for, especially in the sociology department. You want to think about, why is this happening? What is, the sequence of events that leads us there? And then it kind of turned everything on its side. Like, we have so much information on the perspective of the day laborers and what they're going through. And so I think it's also really important and really fascinating to know the perspective of the employers. How do they, what is their justification for the way they act? And, it's easy to kind of point a finger and blame them, but if we can understand their reasons, then we might be able to better help the way that they help others in society. So the question is then, what's the employer perspective on race, immigrant, and labor health issues? So they're traditionally seen as these job creators. Usually their judgments aren't as much critically analyzed because they're the employers. They're creating jobs for people. They're making them, employed. They're giving them a place to work, income. But they do hold significant power that reinstates the racial hierarchy. And that's a lot of what we're concerned about in public health, is that power dynamic between different types of social entities and how it impacts those who are less privileged. They determine who gets hired, who gets promoted. And there's a good research called Brown Collar Workplace, which talks about Latinos segregated into labor-intensive jobs. So if you think about it, they're doing, there's white collar, there's blue collar, and then there's the suggestion for brown collar, which is just keeping Latino immigrants and day laborers in this certain type of level of work. And so for qualitative methodology, has anyone done like qualitative papers? Yeah, there's a couple. It can be a little hard to get people in on what you're talking about, especially if it's about race and racism, and you want to talk to employers about undocumented immigrants and how they feel about their migrant health workforce. And then you're Latino and you're doing it in Texas. So there's definitely elusive employers there that are a little bit skeptical about how they want to approach this topic. And so basically the data was found just through walk-ins, snowball sampling, where you know someone who knows someone who knows someone, semi-structured interviews. And so, yeah, being a Latino sociologist, interviewing white employers was definitely a challenge for Juan, because he did it. And it didn't really, it took a lot of time and it took a lot of patience. And so, when you do any type of qualitative research, the people that you research are going to be looking at you, right? So your skin color and your background is going to influence the way they answer questions, whether or not they want to even talk to you, participate in your study, and sort of there's a different type of dynamic there. And so eventually, there were 20 white employers, 5 Latino, and 1 South Asian that were spoken to. And so you'll notice the perspectives are pretty different, but they actually opened up a lot. And so I'll just talk about some of the, briefly talk about the major findings and how it tie it all back together. So the metaphors, there's racial metaphors of Latinos specifically. There's a book that I'm going to show you in just a second, but they lock yourself into a way of thinking about an issue. So there's this idea that metaphors themselves kind of help you help the society understand how someone or a certain group is viewed. And Brown Tide Rising is a really good book on that. So these are 2 quotes by employers when asked about how they view their Latino immigrant workers. And the first one, they said, they're machines. And we make jokes about it. We make jokes about them being machines. And it's true, they are machines. They're beasts. The second one, they said that it is their nature to work hard. And so they try really hard to keep the job and keep us happy. It's what they know. It's in their nature. So when you look at these types of quotes, you see the metaphors here, right? They're machines, they're beasts, and just having it be in their nature to work hard, in a way, it dehumanizes them. All of a sudden they are removed from sort of these humanistic qualities, and there's they're beasts, they're machines, they're just working hard, they're chugging away, and it's what they know. That's just who they are as people. But what type of people are inherently not human? And so they use these metaphors to sort of understand that and justify that exploitation. And then another form of it is praising. So that's where the idea of pro-Latino racial framing comes in, where you're basically it sounds like you have a really positive view of Latinos, but ultimately, the underlying issues that it supports taking advantage of these workers by justifying their placements and keeping them in dangerous jobs. So, and this was a unanimous view among employers. So just as an example of that, one of the employers were saying, yeah, of course, definitely, any variety of Hispanic worker typically puts out, one, a better product. They work harder, they work faster, they tend to be more punctual, and they complain less. And that sounds great. Who everyone wants a worker that's punctual, works hard, and doesn't complain. But when you think about it, why are they complaining less? because, some of the stuff that we had been talking about had that fear of deportation, the fear of maybe losing their jobs when that's all they have. They talk about them sort of like what we were saying before with the metaphor, sort of dehumanizing the issue of, they're just working so hard and they love it, but this kind of justifies them staying at this lower level because they're just so good at what they do. Let's just keep them at these jobs. And this was kind of unanimously viewed among the employers. They all kind of saw this, they said this in some way or another. And so a lot of it would be comparing Latinos to whites. And so they would call white individuals Americans. And there was a disapproval of white Americans as lazy and complaining too much. Which, in some ways, if you think about it, maybe they were complaining because they understood their rights. And so you don't want to hire someone that complains too much because, once they're more aware of the rights and the freedoms and what they have, then you might lose that worker. And so there was a strong belief that kind of went around with these employers that white workers were not suitable for labor-intensive work. And one employer, he said, yeah, you put a white boy in the kitchen, he's not going to get the job done. I know that sounds so racist to say, but it's so true. And so, they're saying that job's not going to get done. That's why we need to put in the Latino workers because they're going to work hard. They're machines. They don't need to eat or sleep. We're just going to put them there. And that way they'll for sure get the job done. But, we put the Americans in there. They're going to complain. They're going to start being like, oh, but what about this? Or what about working overtime or whatever? And we don't want that. And that was kind of his attitude on why, it made sense to put the Latino workers in the kitchen. But they're still keeps them subservient, keeps them kind of on the same level. So why would an employer prefer to hire an immigrant that doesn't speak English? What do you think? Why would?
And what he's trying to say was, then they'll trip them all up.
Yeah, they're cheaper, and then it's harder to. They don't understand what's going on, and then it's harder to just exploit them, right? Is that what you're getting at? Yeah. Anything else? Exactly. Yeah. There's a power dynamic. When you know what's going on and you're able to speak the language, then you just have ultimately more power. And so language ability became a marker of subservience. You had to kind of remain subservient when you didn't know English fluently because, what else could you do? Then they were able to control their labor and justify limiting promotions. And so the quote the employer said, he said, it's kind of a joke between contractors where they will say, man, you got to get the ones that don't speak English. Once they start speaking English, they are ruined. And so when you think about that, they're deliberately, this is in the construction industry, they're deliberately going out of their way to find people who can't speak English because they're ruined, right? So what does that mean if they're ruined? Exactly. Less likely to be exploited. You can't control somebody when they start, knowing what's going on. So this was a really huge thing that then it can also, justify limiting their promotions because, they don't know the language. So we're going to, they can't be promoted. They can't manage other people. And, you can just kind of stick them to the jobs that they can do without having to interact with others. And so part of what had happened here too was that there was a young white man that had started at this shop. That's the one that's speaking. And he kind of got promoted to management like right away. And it was just sort of this understood thing that, he speaks the language, so he's better able to interact. So employers, they informally discuss their preference for workers who do not report injuries. So we want to get people that are not going to talk, that are not going to complain, and they're not going to report when they're injured. Conditions in place favor Latino laborers for not reporting their injuries. So what they said was a Mexican guy won't tell you he is hurt. He will put duct tape on it and keep working because he needs a job. So in this one, he was referring to getting a really cuts and things on your hands. They're not going to report it. They're just going to wrap it up with duct tape and continue doing their work because they know that threat is there. If I report this could mean my job, which could ultimately, affect my family, affect my life. It's just not worth it. But think about that. If you're working, let's say as in a restaurant and you get like a really bad cut on your hand and you're just putting duct tape on it, think of all the ways it can be infected. We're all in health, right? So that's just, I don't even want to go there. But there's a lot of this that we see all the time in many different types of industries. There was one, when I was in college, then there was someone that worked at a Mexican restaurant, and their cook was standing up on kind of cleaning the ventilation way up high, and they their leg fell into the fryer. It wasn't on, but it was still really, really hot. And it got burned, and, he went to the manager and was like, oh my God. And I think she told him, don't go to the hospital, don't report it. And he didn't. And so I'm not really sure. I mean, I think it wasn't like a duct tape situation, but it was definitely just kind of find your own way to sort of treat it and move on. And so when your own manager is telling you, don't go to the hospital, that can be seen in a lot of different ways. And it can definitely be seen as a threat because they were undocumented for sure. And so employers, they informally discuss their preferences for workers who don't report injuries, as I said. Some minority employers shared that migrant workers are often exploited and discouraged. Consequences are that they are fired and not considered for further work. So this is a kind of interesting story. This was a employer that was interviewed, a minority employer, and they said that they were talking about a story about a workplace injury in, I think it was the construction area. There was this other guy, I believe he got bit by some kind of spider. So there was some kind of weird, when you're exposed to different types of things and different elements, you don't know what you can get, but it seemed to be some sort of spider bite. They kind of acted like everything was okay, and he just endured all this pain. I don't even know how to say this because it's one of those things that you can't prove as to what happened, but he actually passed away. When things happen medically, on the work site, the first thing is not to rush to the hospital. So imagine that type of protocol. It's like the opposite of what we're learning every day is there's, some sort of health issues, some kind of emergency. Step one, don't go to the hospital and definitely don't rush there. And so, you get this kind of injury, you're in excruciating pain, and, eventually this person, whether or not it was related, they passed away. That could have been prevented, I'm sure, if that had been encouraged, was to seek help and treatment for these kinds of issues. And so, the consequences are they see their friends left and right getting fired for reporting these kinds of things. They won't be considered for further work. They'll be seen as someone who complains. And so this is just, the employers would tell us that that is just something that, we look for. We don't want people who complain. But it happens. And this was a, manager kind of revealing that. And so kind of back to the earlier point is that in terms of management, Latinos weren't seen as management material, not just for the language, but they go from being praised to labor-intensive jobs to be seen as not good management. So they're so good at what they do. They're hard workers, they're willing to go the extra mile, but maybe not suitable for management. They don't really have the right skill set. They might not pass the background check. The hinting that they're undocumented because a lot of employers didn't want to straight out tell you that they employ undocumented workers that were mostly Latino. And so they have this horizontal promotion. So you're a cook, so you can train another cook that comes on. That's fine. But we don't want you, in this top management position because you're so good at what you do anyway. Just train this other person. That's basically like a manager. And so they wouldn't have that going up in promotion. They work at the same place for decades in the same position and never get to move up because of their documentation status, because of their limited abilities, maybe for English that were never helped, or maybe an injury prevented them from doing those workplace duties. We got a lot of different responses for that. And so eventually, when we're looking at race, whiteness was seen as authority. So white men reported to be quickly promoted to better paying positions, and they were seen as authority figures for management. So this was the person I was telling you about earlier. He said, but they wouldn't give a Hispanic my job. He was the manager at the construction site. And I think the reason that immigrants listen to me is because I'm a white guy. If all your bosses have always been a white guy, I feel that there's a sense of authority already established. So you're kind of stepping into this hierarchy or this social structure where they sort of already see you as the management, because of the way you look. And it's pretty much true for the most part that their managers, are white men. So, and he hadn't been there that long. There were people that were there for many, many years. And eventually this kind of came back to language. Like, well, I'm kind of interacting with the other people and managing the people, and they don't know English. So that's just kind of how it happens. And so then we asked about a response to anti-immigrant politics. So this question was asked, how do you feel about anti-immigrant views, such as building the wall? Again, it sounds great. It'll get maybe somebody elected or something, but, in reality, I think businessmen are businessmen. And if he's a businessman like he claims he is, he understands what's happening. So who's he? Who's he talking about? Yeah, Trump. At this time, he wasn't elected yet. So that it was still kind of, the catchphrase of the wall was going around. And, this employer is kind of saying it with like a nudge and a wink, like, yeah, sure, you build that wall, but we're going to kind of keep doing what we're doing. And he knows that it's working. We know that it's working. And so employers strongly believe they believe in determining who they can hire. And so they're tolerating anti-immigrant views while keeping their right to hire them. So it's beneficial for them to have Latino workers, to have undocumented workers, but at the same time, they're not really fighting back against anti-immigrant politics. So it's a really kind of complex position. And so what we call interest convergence, the idea that social justice will occur when the dominant white group's interest overlaps with the racial minority group's interest. So we have this kind of converging of interest where when both of them can be benefited at the same time, that's when we have a little bit more hope for social justice to occur. So employers can be potential allies for immigrant workers. They need immigrant workers, right, to run their business and to get things moving. And so they can be a very strong ally in their rights if they really try. So in 1986, for example, agricultural employers were lobbying with Congress to legalize workers and maintain their workforce. And so they passed the Immigration Reform and Control Act as the last policy in 86 that legalized 1.8 million immigrants. And so all of a sudden, when you have the employer on your side, we get this little taste of social justice that, okay, now we have a bunch of immigrants that have now been legalized, can enjoy a lot of rights in this country that they couldn't previously because they had the employers backing them up. And so some of the things that we can recommend in general, as we do, is enforce OSHA standards that currently exist by increased regulations to stop workplace violations. Because as we saw at the very beginning, they have that whole list of rights. Undocumented workers, all workers in this country have rights, but they get exploited because in some way or another, they're not getting access to these rights. And so we can provide safe work environments with high safety standards and supportive workers' compensation benefits. So we want to make sure that the environment they're working in is safe. This is, basic workers' right, as we saw, and that's not happening. And so that's a huge problem because, as we know, it affects so many aspects of their lives. As I've been saying, mental, physical, emotional health, and, general safety, just having a hat, having a glove, that kind of stuff. So if they had access at least to workers' compensation, because accidents happen and nobody should be punished for that. And then supporting minority ownership of businesses, since they can act as advocates for immigrant and minority workers. So, if we have more businesses owned by minorities, that could help with immigrant and minority workers because they'll have kind of a representation. And so there's a lot of different things that we can do, kind of a big picture, which is how we like to think about things. And I think it's important just to know that, those rights are there and the health is kind of being threatened. And so overall, and what we can kind of see from the second part is that employers, they play a really complex role. So they're perpetuating inequalities in the labor force, not all of them, but a lot of them are. But they're also reliant on the workforce and will fight to keep them in their business. So they want their workforce made up of certain people. A lot of undocumented workers really help employers, but at the same time, as much as they're used or needed, these inequalities continue to happen. And so On the other side, immigrant laborers, they face major issues in the labor force. More job injuries, hazards, and other health inequalities that that impacts all aspects of their lives. So we need research to look at factors influencing specific social outcomes. We need more on health inequalities, racial framing, how these two can really come together because they're so related, and kind of make just an easier time for workers and management, because a lot of employers, they're still doing what they can, but it's not always enough, and they're constrained as well from different factors. And then immigrants too, they're trying to work hard, they're trying to make their place in this country, and their big reward is like a lot of this perpetual inequality. And so we're hoping that by learning about these issues, we can kind of help see different sides of the story, and then work together just to promote more social justice. So, thank you.
This evening. We do have some time for questions. We're ending a little bit early, but are there any questions?
Thank you so much for...
Hold on, I'm sorry. I'm going to run and bring the microphone. Manisha, can you use the mic up there?
Sure, yeah.
Hi, okay. Thank you so much for this amazing presentation and really interesting research. I was curious, when interviewing the employers, were there employers from like different sizes of businesses, and were responses different depending on how big a business was? Because for me, intuitively, and obviously it's not like this, but you want your employees to be healthy so they can like do their job well and give you money ultimately. Like that's how business works. Yeah. And then they're saying like, don't go to the hospital because it costs them money. But I wonder, like when you have a really big business, that makes sense because ultimately everything to them is super replaceable, including like human beings, which is awful. But maybe for a smaller business, they have to think a little bit more about like what their cost benefit stuff is. So I was wondering if there were differences in responses based on that.
Yeah, great question. There definitely was. The people, it was hard to get kind of the big corporate managers to talk because obviously, they just didn't want to. And so, it kind of ranged from sort of like the dude Joe running the burger place who was like really chill and was like, oh yeah, let me going on. And then some of the bigger business restaurants, a lot of them were restaurant owners that were, they were kind of willing to talk, but they also, a lot of this stuff was implicit. And so we really had to see the coded language that was used. And that got a little bit, that's where, sometimes you're kind of making assumptions because a lot of them aren't going to flat out say oh yeah, unless that person that had talked about not going to the hospital, she was a minority manager. And so they were a little bit more willing, they were much more willing actually to talk to us about kind of the real things that happened there. And so that's where that information come from. But the ones that were at the corporate chains were very careful with responses. And it was kind of hard to see. It's kind of hard to extract that particular information, but sort of underlying was there. Of course we encourage them to take care of themselves. But then when you ask, okay, so protocol, it's they'll just move on, like the duct tape situation. They'll just, put it on their hand and move on. So, if it's really bad, I'm sure they'll take care of it.
Hi, I was wondering if you could explain a little bit more about the pro-Latino frame that you were discussing. I kind of understand it as using positive language to rationalize exploiting a particular group.
Yeah.
So it's kind of paradoxical, but I was wondering if you could explain it a little bit more.
Sure, yeah. Has anyone heard of the model minority? It's exactly like that, or not exactly. It's very similar to that, where there's kind of positive qualities where, if you're unfamiliar with the model minority myth, it's that I'm South Asian, so Asian Americans, I talk about this a lot, are seen as, very good, very smart, studious students, good at math, when actually there's kind of these underlying factors that when you're sort of put up to those standards, it actually kind of lessens your mental health. There's a lot of issues that go along with it, which is like this huge theory in like a teeny tiny nutshell. So the pro-Latino racial framing is sort of along the same lines, where we're looking at, the way they frame Latinos is, very, very pro. Like these are great people. They're such hard workers, and they really get the job done. And like I said, that's really great. But what it does implicitly is it sort of shapes them in a way where they're, these perfect kind of creatures. They're not people anymore, so they don't have the needs that normal people might have. They don't complain, right? Because they can't. Sometimes they might not have the English abilities. They might not have the resources available. But they've seen the positive light. Oh, they're people that don't complain, and so that's why they're such good workers. So it's kind of like that, if that makes sense. And that is a little bit more Juan's theory, so you can bug him. You can ask him about that too. Yeah. Oh yeah, yeah. Fagan was really big. He's a huge sociologist at A&M, so that's a lot of stems from his white racial frame.
We have another question here.
Yeah.
Hi. So I know that you mentioned that a lot of the workers use a lot of the fake Social Security numbers, but I've actually worked on the opposite side of that. I used to work for the state of California EDD, and when someone would have to file for their state disability, and they couldn't file for their state disability because that particular population used their Social Security number, it will prohibit or hold up their disability that is rightfully theirs.
Right.
So I know the opposite end of it and how inconvenient it is for somebody that, trying to file their state disability. And I want to know what has there been anything put in place to prevent that from happening for people that do deserve their state disability for their correct Social Security number?
Yeah, that's a great point. And that's like definitely a huge issue. And I have heard of that before too, because we don't, even though they have these fake Social Security numbers, that actually may be someone's Social Security number, right? And that's a really good point. I'm actually not sure if they have been taking steps towards this, but kind of my idealistic recommendation is if we, provide Social Security numbers that for these individuals and in a sense, legalize these undocumented immigrants, then they'll have their own unique numbers to use. And that's kind of, like I said, that's the idealized version of how I think the problem should be solved. But in terms of just putting the measures in place, I think that's the main thing that's happening is just kind of if it happens, catch it, and then it's on their record and they're not able to use those numbers anymore.
So no doubt white people, I guess specifically in your example here, white men are on the, the giving end of this inequality. In your research or in your observation, I'm just curious if you ever came across instances where other non-dominant groups or even Latinos were complicit in a position of power to perpetuate the system that you described here today.
Yeah, there's definitely situations where there are minority groups in power that are exploiting other minority groups. Is that your question? Yeah. So for the purposes of this study, the people that we talked to didn't fall in that category, but I definitely have read research. I've definitely seen it happen, people admitting it, that, they sort of adopt that similar mentality. And a lot of it kind of comes to the idea of, legalization or not, being authorized to work here or not. I think that this, the Trump quote might have been a Latino employer from my understanding. So, it's definitely not just race-based. It's a power dynamic that happens, but yeah, definitely.
Any other questions? So one of the questions I ask all of our lecturers in this series is, as public health practitioners and folks who will be working as clinicians with a public health background, what kind of ideas or recommendations do you have for them in their work as future clinicians and public health practitioners?
Yeah. So, we learn in public health a lot, education and access. And so if there's and I don't know if this is a way, but if there is a way to kind of reach these groups, knowing that their rights to health, and the accessibility of having, especially if you're a clinician, how would it work if I did get injured on the job? Like, how would you treat me? Is there a way, to get to your services where I, maybe can sidestep a couple, things, but still get treated? Because as public health practitioners and as health clinicians, that's ultimately what we want. We want everyone to be safe and healthy and happy. And so I would say that, just having, if there's a way to sort of educate individuals on, where they can get this access and what that might consist of, and will this threaten their job or not, is just sort of basic knowledge that we all have that maybe they don't. And so I would definitely encourage that. I'm in public health as well. I studied health promotion and community health, and a lot of it is just getting into the communities that need it. You don't have to go to their workplace, but if you can get an in the community and kind of jump in on the community discussion and say, hey, these are your rights, and if something happens on the job, if you get injured, if you get sick, here's what you can do. And these are the types of clinics that can help. These are the clinics that won't charge you quite as much, or that may take, your insurance that may be a little bit hidden, and just kind of encourage that kind of practice is sort of the best we can do from our field.
Well, thank you again, Manisha, Salinas. We really appreciate you standing in for your husband this evening, and appreciate you sharing his really important and interesting work. Let's give her a hand.
Thanks, guys.